Let's start off by talking about this. What do we mean when we talk about a learning disorder? When we use the term learning disorder, what we mean is that we have a child who is developmentally prepared to learn something and who's receiving instruction, but nonetheless, they're not making progress. So this is not the case of a child who's being challenged outside of their developmental preparedness. This is not a third grader who's trying to learn calculus. This is somebody who is developmentally ready for instruction, receiving instruction, but somehow it's just not translating. And so the question is, why not? And metaphorically, you can think about the example of a car that won't start. If that's happening, then what you need is for a mechanic to look under the hood and see which one of the 100 things that need to happen for a car to run is not working the right way. Is it a spark plug? Is it the starter engine? What is it that needs to be addressed? In a similar way, when we do an evaluation, we are going through different aspects of a child's functioning: working memory, executive functioning, language, memory, attention, and trying to understand what is getting in their way and what is preventing them from learning and from making progress. When we're able to do that, we're then able to make a diagnosis and also offer recommendations for what are the right services and accommodations that will help them to make progress. An important thing to think about when you're choosing an evaluator is not only who can do that work, but also who can move it forward. You're looking for someone who is willing and able to come to the child's school to observe a classroom, speak with a teacher, participate in a team meeting, or perhaps communicate with a counselor or with other clinicians. It's critical in cases of learning disorders that the evaluator be involved with the school and with the rest of the team.